Good morning, I'm Danita Cohen, the Chief Experience Officer at UMC, and I am joined today by Dr. Luis Medina Garcia, who is one of our very fantastic infectious disease physicians, and we are both actually smiling today. Good morning.
We are. We're smiling under the mask to
We
protect each
definitely
other.
are, to protect each other. Let's start with the masks. We're wearing them because it's important, and this mask isn't protecting me, it's protecting you from me.
That's correct.
Yes.
So the CDC has come out with guidelines and recommendations on the wearing of face masks or face coverings in public. The idea behind that is not that the mask protects the wearer of the mask, but it protects the people around them. Every time that we speak or breathe, small amounts of saliva are expelled into the air. And if a person has COVID or either with symptoms or without symptoms, those small droplets of saliva are suspended in the air. So if you're in the vicinity of that person, you potentially could then take a breath and there's a potential for infection there. So by wearing the mask, those small droplets of saliva are trapped on the inside part of the mask, and that really protects everybody else, right? So for me to wear a mask, the intent is to protect you. For the other person in the room or in the vicinity wearing a mask, the intent is to protect each other. So it's what we call source control. You keep it contained in the mask, and then you dispose of the mask if it's a surgical mask, or if it's a cloth mask that you can launder at home, then that's how you clean it and then re-wear it when you're in public.
So when I take this off at night or when I take it off in the car, how dirty is the inside of it? And should I throw it right away? I mean, everything's contaminating. If I put my keys on top of the mask, right, then that's contaminated.
Yeah.
Yes.
So how contaminated is the mask? We have to remember that the mouth is not a sterile place. It's not a clean place proper. There's a lot of bacteria in there. And those small droplets of saliva also have other bacteria. We're really not worried about those because our immune system is well equipped to handle any of those things. We're worried about the potential of COVID being in that saliva. But it's really important to underscore the technique in donning, which is the fancy word for saying to put a mask on or a protective equipment on, and doffing, which is taking it off. It's important to not touch the front part of the mask, because if you were in contact with somebody's droplets of saliva, they'll land on the outside of the mask. So you always want to handle them from the earpieces. And when you can, place it on a surface that you can hang. So a lot of people, I'm not saying that this is the right thing to do, but having a special place to put that mask is important. So if you have a paper bag in your car, you could drop that in there. Some people hang it on the shift of the car, or
I've seen them hanging from the mirrors.
Hanging from the mirrors. And that's okay, as long as you try to not touch it. And then after you touch it, you still have to sanitize your hands. So if you have hand sanitizer, use it while you're out and about. And if you're at a place where you have soap and water available, that's really the best way to do it.
Any idea how long that bacteria sits on the mask? Like
Well,
by next Tuesday, is it clean again?
So it's not that it's clean, because there's saliva and stuff in it, but it probably won't present a risk of infection. Plus, these are the own bacteria that you have in your mouth. So if they're not making you sick all day, every day, they're not going to make you sick later. As it pertains to COVID, you want to, not touch it as much as you can. And then if you are using a cloth mask that you can launder, to wash those frequently. So if you have 5 sets of cloth masks, you want to wash those, during the week, so that every time you put a new one on for the day, it's a fresh mask.
So how are we doing? How are we doing as a state? And the biggest question everybody wants to know right now is, how are we doing with flattening the curve? Because that seemed to be the trigger for when things would start to open up again.
So Nevada is doing particularly well. The Southern Nevada Health District, under the leadership of Dr. Legan, has done an amazing job. We were at a press conference yesterday where those questions were asked, and as compared to other states, we are doing very well, and that is without a doubt in large part due to the efforts of the community of staying at home. The hospitals have prepared well. We have met with each other as an institution and come up with plans to have sufficient capacity to take care of these patients. And there is the ability of the hospital systems to take care of COVID patients, and that's also part of the plan to reopen. So I think we're doing well. Testing and availability of testing has significantly improved. There's multiple testing venues. UMC has participated in multiple of these. We have a site out at the Orleans Casino, which we're partnering with Clark County, where 1,000 tests a day can be done. These are done by appointment only, but it's very effective, a very efficient process. The turnaround time since you drive up there, this is drive-up testing, is about 8 minutes. So 5 to 8 minutes. So it's very high throughput, very fast, very efficient.
And it's very easy, as you said, to sign on. You can go to our website at umcsn.com and then click on the COVID-19 Testing Center, follow the prompts to go to public, and then you can register there. We'll call and set up an appointment for you. And like you said, it's so easy to drive through. And the other important thing we should mention is of the folks who have been tested at that particular location, which are asymptomatic people not showing symptoms. It's not a care location, it's a testing location. 1% have been positive out of all the tests that we've done.
That's correct.
That's showing promising news.
Right. So there's, the importance of obtaining that data, which is then funneled through the health authorities for analysis, so that they can determine the snapshot of people that have the infection and kind of see where we're at. And that has statistical significance, meaning it's really important to know what those numbers are, because that will then inform future decisions on how fast to open up, which sectors can open up first, what kind of interventions you need to have for monitoring, because those things will come up. So one of the things that happens when you start doing diagnostic tests is that you will find patients that are positive that you didn't suspect them to be positive. And that's important to correlate that with a percentage of positive patients. So you have a total number of cases, and then you have the number which is the percentage of patients tested that were positive. And that may take a lot more explaining, but you essentially want to see, out of all those patients you tested, what percentage are positive. And that's also one of the markers that is included in that assessment of going to the next phase.
Yes, so again, showing some very promising news
Correct.
from the community testing sites.
Correct.
So folks have the ability here on the town hall to send in some questions. So we have some questions for you from the community. So they'll pop up here on the screen. The first question is, I was using Scotch tape and thought, wonder if the virus can survive between the tape and what I'm sticking it to. Could this cause someone to get sick when the tape comes off? What about mail and stamps?
This is very unlikely. So the virus can survive in surfaces for a limited amount of time. There was a famous paper in the New England Journal of Medicine, and I think it was 3 or 4 days on hard surfaces. But the reality is that you would have to have a significant amount of virus particles in that to then transfer to your hands and then make it into your body, either by rubbing your eyes or touching your face. So if you're using a piece of Scotch tape to, stick something on a wall, really the risk there is not even measurable.
It is interesting how we have completely rethought our daily lives, right? Thinking about everything as a surface that could contain the virus.
And that's needed. You have to be aware of these things to be able to protect yourself. But stuff like that is not considered risky to me.
Okay. And if you're worried, wash your hands after you open
right,
the mail.
And the hand hygiene has to be in every step of the way.
Okay.
Right. So if you go out and get the mail, it's very unlikely that would have virus in it that could make you sick. But you go get the mail, you put it wherever you put it, and then you go wash your hands. You open the mail, you handle the mail, wash your hands again. So that's going to help keep us safe.
I've read the virus lives for 24 hours on paper, fabric, and cardboard, and 3 days on hard surfaces. Can I just wait 3 days to put away my non-perishable groceries rather than handling and sanitizing these items the same day I buy them?
You can. The question is, do you need to? If it makes people feel better to sanitize their groceries, that's okay. But it's probably not necessary. So if you have things that you brought in from the store and they're non-perishable and you want to wait 3 days for them before you stock them in your pantry, that's okay. If you want to put them in the pantry, that's also okay. Because either way, hand washing will help you get rid of those virus particles in your hands and avoid them coming in contact with your mucosa, so your eyes or your nose or your mouth.
Okay, so Charlene can put her stuff away if she wants to.
Wash your hands.
Wash your hands. Okay. What else do you have for us here, Victor? Next question. I read that in March, U.S. hospitals doubled their orders of hydroxychloroquine. Did Nevada hospitals do the same?
So hydroxychloroquine was a drug that earlier in the epidemic was suspected of having a beneficial effect in patients infected with COVID. And research across the globe has shown that it probably does not help very much. And there are risks associated with the use of hydroxychloroquine. Currently, the data seems to point against the use of that drug. The question is asking whether the hospitals ordered hydroxychloroquine, and I can almost assure you that every hospital ordered as much as they could. Initially, very few hospitals could get it because there was a very limited supply out there. That is no longer a problem for the most part now, but now that we have it available, really the trend is that we don't want to use it because the risk seems to outweigh the benefit or the potential benefit.
And folks use that drug for other things and have been for years.
Right, and we're not telling people not to use it. The physicians will make that decision based on the available evidence. But most authorities are saying be very careful with your use of that.
Okay, next question. Should I wear gloves? When is it okay not to wear gloves?
The glove wearing part is a very good question.
It is a really good question.
Because I think one has to be careful of the sense of security, the false sense of security that wearing gloves provides. Right? So the virus, we know, does not go in through intact skin. So that's not a way for you to get the disease. And the idea is if you're wearing gloves and you're touching things, that you won't contaminate your hands. But wearing gloves without being vigilant of not touching your face, that's really the key. So if you're wearing gloves, you must be very careful to not touch your face, and then you must dispose of the gloves properly. We see that people just toss them in the street, and that really is A, littering, which is a crime, and then B, that presents a biohazard for whoever has to pick up the gloves. You're putting people at risk. And it's just not necessary. It doesn't protect you as people wish it would. Hand washing and hand sanitizing really goes a long way.
Because
so if you don't wear the gloves,
with the glove,
exactly.
Yeah.
I think if you focus more on not touching and sanitizing your hands, that's going to protect you much better than gloves ever would.
Okay, next question. I'm 81 and my granddaughter wants to bring over some brownies to check on me and give me a treat. Well, that sounds like a very nice thing to do, right? But is it safe to accept the visit and the gift? And that's from Grandpa George.
So I'd say accept all the love and the brownies.
And the brownies, good.
But not the visit. And it's very difficult because there's so much unknown things about how the virus transmits. But we know that the elderly population is at the highest risk. So if there's any intervention that you can do to protect that vulnerable part of the society, we should do it. But the emotional aspect, the impact on people's feelings and the stress of being in total isolation is very difficult. So shared decision making is important between the family members and in consultation with their physicians to say, look, could we meet, say, in the backyard? We'll be wearing masks, be out in the open air with, more than 6 feet apart so that you can talk to each other. You can come deliver your cookies and then have a brief visit and then go back home. And that serves the purpose of giving the gift, showing the love, and still keeping each other safe.
Grandpa can keep the brownies, though.
Absolutely.
Yes. All right. This next question has to do with public pools, which I don't think are open just yet. But the question is, can COVID-19 be transmitted at public pools or even in backyard pools, for that matter, if swimmers are 6 feet apart? So I guess the question is, does it live in the water?
So I don't think that that's ever been looked at proper. All pools, especially public pools, have very stringent safety protocols for sanitizing the water, and there's chlorine in that water at high concentrations. I don't think the virus would survive in the chlorinated water. The 6 feet apart thing, it's difficult to monitor, really. I mean, you have a lifeguard there when there is one available, and then they would have to be also hall monitors, so to speak, to tell people to keep a distance. But the close contact with people is really the risky procedure. there's really no data to say that they're protected or not at the pool. And the risk is not the pool, the risk is being close to each other.
It's the lounge chairs, it's
Right.
all the other things that go on at the pool.
Exactly.
All right. This next question is about the pneumonia vaccine and if you think that would help current COVID patients. So can the current pneumonia vaccine provide protection from the type of pneumonia people get from COVID-19?
So 2 different points to touch on that. All vaccines that are recommended by age group by the United States Preventive Services Task Force should continue to be received. The type of pneumonia you get with COVID is a viral pneumonia. So getting a pneumonia vaccine, which protects you against invasive pneumococcal disease, a particular bacteria that causes pneumonia, won't prevent you to get COVID pneumonia if you get it. But the advantage of getting that vaccine is that if you were to pick up COVID, it'll protect you against the other bacterial pneumonia on top of the COVID pneumonia. So one less thing to worry about, an additional layer of protection. So I think people should continue to get the vaccines that are appropriate for their age and their associated illnesses to prevent a complication if they were to get COVID. So you don't have to worry about 2 processes.
Okay. The next question is about antibody testing, which we are getting very close to, but when and where can we get the antibody testing? And explain what antibody testing is too for me.
So there's 2 types of testing for COVID. One is the PCR testing, which is the sample they get from your nose or from your mouth. In the near future, I think you can get it also from saliva, but that's before it's ready for prime time. And that detects the genetic material of the virus, the RNA of the virus. And that test is meant to diagnose people that acutely have the disease, meaning you are sick with that disease now. The other type of testing is antibody testing. And antibodies are small proteins that your body's immune system makes as markers of memory of having had an infection. Think of it as little flags. So if you acquire an infection, your body fights through it, you successfully recover, you form these antibodies. And they are your body's immune memory of that organism that made you sick. So that if you were to come in contact with it again in the future, those flags will recognize that pathogen, the bacteria or virus that made you ill before. They'll tag it and they'll signify to your immune system, hey, go get him. Don't let him make us sick again. So that type of test is in development. There's many companies that have developed assays for this. Some of which have achieved EUA, which is emergency use authorization by the FDA, and they are available out in the market. What it tells you, again, is just that you have had the disease before. The question that is not completely answered is whether if you have antibodies, if you have an immune memory of the virus, does that really protect you?
And for how long?
And
right?
And for how long? So the jury's out on that still. Some animal model studies have suggested that you do have protective immunity, so hopefully this will pan out. Some labs do get it. I think LabCorp and Quest do offer it. At UMC, we will be offering it shortly, hopefully the beginning of June, and that'll be available through the Quick Cares and perhaps other, community testing sites.
So going back to the first test that you mentioned, the actual test, do I have it today or not? What have you seen as far as false positives and false negatives?
So false positives are rare, I think. False negatives, it depends on the brand of the assay. So the brand of the test that you're using. It depends on if you're taking a sample from the back of the nose, from the mouth, or from saliva. And it depends when you got initially infected. So we know that right before people develop symptoms, and those that do develop symptoms, the ability of the test to detect the disease is the highest. And as the disease progresses, the virus seems to go down further into your lungs. So the chances of you catching it up in the nose or the throat are less.
So it lives in a certain part of the body. It's not everywhere.
Right. So it's a complicated answer to that. They're fairly good tests, though. So I hope that answered the question.
It does answer the question. Let me ask you too, as things start to open up, and over the weekend things did start to slowly open up, what should we all be doing to continue to protect ourselves? Because I know that you have really cautioned against not wanting to go backwards. We want to continue to go forwards as our community continues to open. So what should we all be doing?
I think the first thing to consider is to remember that we're all in together. And there's difficulties with information, how information is conveyed, what information you can trust and what you can't. And people have different beliefs of it, but we try to make everything based on the science of it. We know this is a highly contagious disease, and that it's hard to predict who will do well and who won't. So when we try to convince people that are not non-believers, so to speak, in it, it's hard to push that message across. And the opposite is true. You have to have some degree of economic activity and social bonds, but you have to be careful with it. So be kind to each other. Wear a mask when you can. If somebody, asks you to be patient at a restaurant or a service, just, we're all in it together. Try to make it as easy as possible.
Hands, right?
Don't stop washing your hands, and keep looking for the advice of the health authorities.
Okay. Next question: should you get a test even if you have no symptoms?
So that's a complicated answer. And it depends on the level of comfort of the person that seeks the test. Anybody that has symptoms, I think, should definitely be tested. Anybody that has been in contact with someone who was either suspected to have COVID or confirmed to have COVID should be tested. And that's to assist in the contact tracing aspect with the health department, so that you can keep those people out of society and prevent the further spread. Initially, because testing was not widely available, the recommendations for public health authorities were to only test symptomatic patients. But now that we have much more ability to test, they have opened it up to patients without symptoms.
And that's what we're doing at the Orleans, as you mentioned.
That's right.
Yep,
and that's under the direction of the health department. If you want to go get tested, you can go get tested.
Okay. And we should also mention that there's no out-of-pocket cost at the Orleans.
Correct.
So please, again, go to our website, umcsn.com, click on the COVID-19 Testing Center, follow the prompts, and we will see you over at the Orleans. And as you said, it's a 5 to 8 minute process. Super easy. You don't even get out of your car. And then you'll get your results online on our MyChart through UMCSN.
Just one more comment in addition to that. I know that some people in the community who have an immigration status that is worrisome are worried about going to these places. They should know that we don't collect any immigration information.
Absolutely. Yep. We just want to get our community
if you need
back
to be
health,
tested,
right?
go get tested.
Yes. Okay, here comes another question. Is diarrhea and an upset stomach a symptom of COVID-19 if there is no fever or body aches?
It can be. It's very difficult to say.
That's super scary that you say that, by the way.
So initially, we were using a set of symptoms to try to identify patients at risk for COVID, and that was a fairly short list. They were mostly respiratory symptoms or respiratory-related symptoms. But as the disease progresses, you find different manifestations or different symptoms that are associated with it, and that list is so large that it's hard to, keep a grip on that. You can have abdominal pain or diarrhea with COVID infection. But it's really impossible to say. If you only had that symptom, are you at risk of it? Probably not.
And on our website, umcsn.com, first you'll see the COVID-19 Testing Center, and then to the bottom right of that, you will see our telehealth link. So that would be a really good question for our telehealth physicians. Just log onto our website and follow the prompts, because then you don't even have to come into a quick care or into the emergency room. You can do all of your assessment there online. So
absolutely.
And how the results are about 24 to 48 hours, right, when they come through the Orleans to get tested?
Yes. So the tests are collected at the community test site at the Orleans. Samples are brought over to UMC and processed in our lab. We've had a large expansion of our lab capacity, and the results are automatically reported to the app. So on the MyChart app that you sign up for to get scheduled for a test, there's a section there on results. If you have a result that says detected, that means that you do have the virus in you. So detected equals positive test, meaning you have the infection. And the other one is not detected, which is a negative test, meaning you do not have the infection. If there's any questions on what to do next after that. If you have a positive test, naturally the first thing is to stay at home, and then also seek the advice of the health department so that they can initiate contact tracing. We report that automatically to the health department, so they will reach out to you. But if you have any specific questions, reach out to the health department and or to your primary care physician.
And we should say that if it's a positive test, one of our UMC physicians, most likely you, will be reaching out to the patient to have those further conversations. So they're not saying detected and that's the last they hear from us. We are definitely back in contact with them.
So we're partnering with our outpatient arm of UMC to call these patients and give them instructions and answer questions. But that's an invitation also for people to use the telehealth tool to say, okay, I went to get tested. This is the result of it. Can we talk a little bit more about it?
So for people who say, having a swab stuck up my nose, stuck in my throat, that just doesn't seem like a really good time to me. Explain what that process is like.
So it's very fast. So the nasopharyngeal, so the one that looks at the deep part of the back of your nose, is a little bit more of a delicate test, right? So you will go to the test site, they'll use all the protective equipment, they'll get a swab. It's a long, thin, flexible swab, and they'll slowly introduce it until they find gentle resistance, right? All of these things are very gentle, but they're uncomfortable because your body's not designed to have anything back in there. So they put it in there, it's about 5 seconds, and then they take it out, and then they put it on the other nostril. It's also very quick. So that's the first type of sample procurement. The second one is the anterior nares, so the front part of your nose, which is, a lot of people I think have used Q-tips to clean out their nose, which is not something that we would recommend, but I know people do it. So that's much quicker and less uncomfortable. And then there's the oropharyngeal sample, which is the back of the throat. You would open your mouth, they would examine you, do a quick swab, and go. And then in the future, I think just saliva will be something that we can use to test.
And the ones that we're doing at the Orleans are
so it's the oropharyngeal, this throat swab, and it takes literally 3 seconds.
So for somebody who is asymptomatic, but they come up detected, which means positive, as you were just mentioning, what advice are you going to give them on how to protect their family and those who they live at home with?
Right, so if you have a positive test, try to stay at home as much as you can. The closer you are to your family, and it's difficult sometimes to social distance inside a home, it's reasonable for that family to keep an eye out for the development of any symptoms. If you want to get tested and the rest of your family tested, that's also reasonable because it provides that data on how many members of your household then became infected. But if you are feeling fine and everybody else is feeling fine, just stay at home, wait 10 days. That's the recommendation from CDC before you start, getting back out there as needed.
All right. Thank you so much. Again, our website at UMC is umcsn.com. There on the homepage, you will find the COVID Testing Center link that we have been talking about all morning. We have testing out at the Orleans drive-thru, as Dr. Medina was saying. It is no out-of-pocket charge, so if you'd like to come by, we have a full team there waiting for you. And then our telehealth, of course, is also on our website, umcsn.com. Just click on the telehealth link. You can stay at home and get the health information you need from our medical experts. So thank you for joining us. Thank you so much.
You're
Your
welcome.
Professionalism and expertise throughout this whole pandemic is extremely admirable, and I'm very proud to work beside you.
We're all in it together.
Thank you so much. Thanks so much for joining us here on Clark County Television. We will see you next time. Until then, wear your mask, wash your hands, and take care of yourself and your family.